Next today, we have Solaris Endovascular. Solaris is a medical device company that is building next-generation endovascular stent graft technologies that will overcome the current mechanical and biological limitations of the current vascular devices. Please welcome Randy Hubbell, CEO, to tell you all about it.
Great. Thank you, Sarah. Hi. Hey, we're a medical device company focusing on endovascular. Endovascular is going to be the arteries and veins of the legs, the arms, and the trunk of the body, everywhere but the heart and the brain. Those arteries have a couple of different diseases, formations that create a problem for those vessels in that they reduce in size, they get clogged, they have what's called a stenosis or a lesion, which is a blockage. For dialysis patients, this is the lifeline for them. What happens is we create a circuit tying an artery and vein together. The dialysis patient needle will go into the artery, taking the blood out, put it through the artificial kidney machine, put it back to the vein. That circuit has significant problems that need to be repaired frequently to allow the patient to continue on dialysis so that they live. Peripheral artery disease is the same disease process as coronary artery disease. When it happens in your legs, it reduces the blood flow to the lower extremities, causing pain, difficult walking, and potential amputation. One of the major ways to treat these diseases is with a covered stent. This is a blown-up version. This is a pretty small product that goes in the vessels, the vein or the artery. It's a nitinol metal stent covered with PTFE. The PTFE prevents cell migration, so you don't get a restenosis. It doesn't block off again. But all of these products have challenges on the edges called edge restenosis. We have a product on the market today that is very competitive. These features and benefits highlight the competitiveness of it. We're one of 4 outside the US. We have approval in 40 countries. We focus on about 10 where we're driving $5 million of sales this year. When you look at dialysis access patients and they come back with a failed graft, they will be treated with either balloon angioplasty or covered stents. Today, when you're treated with balloon angioplasty, at the 6-month point, you can expect half of those patients to come back and have that treatment have failed. With covered stents, the 3 competitors plus ours all together, that rate is about 30% of your repair fails at 6 months. We just released the new data on our second product, which is in the clinic. It's in study. It has a drug on the edge of it. And we're happy to say of the 40 patients we treated, only all 38 were still functioning at 6 months. So we had a 95% patency or only 2 failures. This is going to revolutionize peripheral artery disease in treating dialysis patients. The market's about $1.5 billion. When we come out with the drug-eluting, it'll grow to 3. This is a depiction of the companies that play in this space today. The ones at the bottom are most of them are heavily into endovascular, but they do not have a covered stent. Only Gore, Bard, and Merit and Solaris have a covered stent. The others are spending a lot of money on sales reps without being able to participate in this segment of the market. In order to do so, they would have to acquire us, and we're the only ones in the world that have a drug-eluting version. So scarcity creates value. So I've got 13 years experience at J&J, 5 at Boston Scientific. I've done multiple startups. Cardiva, we had a $500 million exit to Haemonetics, and Carmel was a company I took out of Carnegie Mellon on a journey to become public on the NASDAQ in the summer of 2023. Here's our revenue projection curves. Obviously, when we get our 2 products approved in the US, that US market has tremendous value and that revenue goes up substantially. Our projection is that we will exit before we launch these products and commercialize them in the US. These are 2 products that are going to be registered in the US pretty much simultaneously. We have a convertible note. This is the first money we have taken in so far. I acquired these assets with equity. We've got a $3 million commitment towards this convertible note of $5 million, 8% interest, 25% discount to the next equity round. We're in conversations with VCs now about an equity round. Checks that come in November have a 20% warrant coverage. Fujitsu Forum did the due diligence for us, and this is their multiple calculation of a 8 to 14x return on a $500 to $800 million acquisition. And please join me in the breakout room. Thank you.